Hello, this is Dr. Tony Nalda. I'm here to talk to you regarding our cool-down passive molding anterior L5 increased sacral base blocking. Now, this blocking system is extremely effective in handling L5, which traditionally can be a very difficult type of subluxation pattern to handle. So let's discuss some of the details. So first of all, I want to kind of look at the X-rays of both conditions. So here we can kind of see what's happening. If you look at this first X-ray here on the left, we're going to see something very specific occur down here at L5. You can see here's your posterior sacral base line, and here's your posterior L5 line. And you can see between this line, you can see L5 has moved anterior about 3 millimeters. It is very difficult to get L5 and drive it this way, to drive it back. In fact, I don't know any adjustment that actually does that. So our goal here is to try to bring the sacrum forward under L5 directly. So as opposed to trying to drive L5 this way, we want to try to drive sacral base that way. Now, if you look over here in this next X-ray, you can see this is a sacrum, looking at the sacrum. Now in this position, you can see L5 doesn't look that anterior. It's slightly anterior, but one thing we can definitely do is we see an increased sacral base. This sacral base should be between 30 and 35 degrees. Here we're seeing at 42. It can kind of just look like it's too extended for you. And you can also see a very classic position. We normally see an anterior T12 when we have an increased sacral base, and in this case we actually have both of those things. So we want to bring sacral base, we want to incline it more in this inclination as opposed to like this. So we want to change the way this is inclined and decrease this angle to 30 to 35 degrees. That will help bring T12 more posterior and help realign this correctly. So let's talk about how we do this blocking. So this is how we do the blocking setup, and the blocking setup is very similar to the way we do an anterior L5 adjustment. And the reason why, because it's very hard to, like I said, to drive L5 from A to P by contacting L5. So therefore we have to bring sacrum P to A under L5. Primarily what you're trying to do is you're trying to reduce the lordosis of the lumbar curve. That's our goal here, is we're trying to reduce the lumbar curve. So we use two primary blocks. We use one spinal wedge, and we use their cervical roll. This one I have the medium large roll in place. It's the most common roll used, but they would use their appropriately fitted spinal mold or spinal roll that you would recommend for them to use. Here, the blocking system is pretty easy. The patient is going to be laying with their sacrum here with the fat side towards their feet, and the idea is you're trying to rock their sacrum into this flexion position. We're trying to flex the sacrum and trying to bring that anterior T12 posterior. They're going to be laying on this table with this roll under their cervical spine, and they can push their spine right down into the table to actually flatten out that lumbar spine even greater to help assist in this blocking. So let me show you a picture of a patient actually doing it. So here you can see a patient actually setting it up. She's laying on her back. She has her cervical roll in place. And you can see here's the block. It's right in her sacrum, kind of tilting her sacrum in this direction. So therefore L5 has to move anterior to posterior. She can contract her core and actually push her lumbar spine down into this table to increase this effect. She has her knees bent, and the reason why most patients like to have their knee bent, it takes a little bit of pressure off. They can do it straight if they find that to be more comfortable, but doing it bent tends to be the most common way they do it. Again, this is a 20-minute position. They don't want to be sleeping all night like this. They also can use this type of blocking to help manage their pain when they can't get into your office. So they can just set up in this blocking procedure, and it helps reduce what they're feeling. If they're feeling pain in their low back or down their legs, this tends to help manage the L5 subluxation when they can't get into your office to get an adjustment. Very effective form of blocking. Now, some people I've heard have put some weights, 5 or 10 or 15 and 20 pounds along their abs. I do believe that can have a positive effect on pushing the lumbar spine down into this table to help reduce that lumbar curve. And that's the concept here. We're just trying to do whatever we can to reduce the lumbar curve, to reduce the normal lordosis that exists there. But understand, if you're trying to reduce the lordosis that exists, by decreasing this lordosis in the lumbar spine, we automatically know this has effect in the lordosis in the cervical spine. So it may be kind of working against each other here a little bit, but we have to manage this anterior L5 because it's an issue. So let's go over the steps. The indication, it's done primarily to reduce anterior L5, and it can also be done to reduce and increase sacral base because it's trying to decrease that sacral base angle to help reduce an anterior L5. It's done for a 20-minute period of time, and we can use it for any kind of cool down phase with after activity. And it's done once per day. If they're doing any type of activity, like any kind of exercise or any kind of rehabilitation or any type of other exercises outside their spinal exercises, they can always use this as a cool down phase throughout their day to help their spine slowly creep back into the normal position. Remember, that's what we're using, is the creep effect, slow sustained force over a long period of time. And like I said, a lot of patients can use this to manage their symptoms of an anterior L5 while they're getting it corrected with the care in your clinic and what they're doing at home. And understand they can always push their abs or push their spine down into the table or into the floor to help assist in this actual correction. And people can also use weights on the abdomen to actually try to create more of a force as well. So we created a video here of how to actually perform this type of blocking. So go ahead and watch this video, and then I'll be back to finish up this one.
Hello, this is Dr. Tony Nolly here, talking to you regarding your home blocking setup. Today's position we'll be talking about something called anterior L5 or increased sacral base blocking. This blocking setup is designed to use for about 20 minutes, so this is not a position that you would sleep in. However, sometimes your doctor could prescribe it for you to go longer than that. The blocking setup is pretty simple. You can use one of your wedges, and this fat part, or the large part, will be facing down towards your feet. It'll be just like this in the lower part of your tailbone, and then you're going to be using your appropriate cervical roll. So this one I'm using the most common, which is going to be the large medium, but if you have a small medium or if you have a firm one that you're using, that's the one you would use. And that one's going to go, of course, going to go on your cervical spine just like this. To get set up properly, it's kind of a two-part position, so we're going to get her neck kind of set up properly so she comes down, sets her neck up. Then the easiest way to get this under is to go ahead and lift up your hips, and you put it right on your tailbone, just like that. And what it's going to do is going to rock your hips. Most people tend to like to have their legs bent. You can have your legs straight, but it tends to be less comfortable. And the idea is that you lay just like this for about 20 minutes, and it's going to rock your sacrum or your pelvis in this direction. You can also do an exercise while you're on here, some slight contractions. You can actually contract your abs and try to push your lumbar spine flat down to the table. So go ahead and do that, kind of push down, just like that. Kind of push your lumbar spine or your low back flat, hold it for 10 seconds, and then you relax. And you can repeat that over the 20-minute period of time that you're laying on this roll. This is a very powerful setup to help reduce some low back subluxations, and it's something I definitely use a lot. Just make sure you follow your doctor's prescriptions to the appropriate cervical roll and the time that you should be doing this.
So to do this in the office, what kind of indications that you can do it is that mostly patients can be pre-blocked, or you can adjust them like this and kind of leave them blocked like this and walk over to your next adjustment, and they can stay there for 2 to 5 minutes after their adjustment to help this sit in place. But to do this for effectively 20-minute period of time in your clinic becomes very, very difficult. One thing I do find though is that if patients can't necessarily block, they can do kind of like a glute tuck after their adjustment to kind of to mimic the force and kind of decrease their sacral base while they're wearing their head weights. What I mean here, if this patient would actually contract their abs and push their spine down into this table, it kind of flattens their lumbar spine and brings their hips forward. Well, that exact same motion can be replicated when they're standing, is they can tuck their hips under their abs or under their torso and flatten out their lumbar curve. They can do that standing while they're on their biplate with head weights. That can help assist the very similar type of blocking procedure that they're doing, but they can actually do it as an isometric or as a standing exercise. Now understand, it's not creep, it's not a slow sustained force for a long period of time, but it does have an effect in helping stabilize their subluxation and managing their anterior L5. So I hope you enjoyed this video on how we do anterior L5 increased sacral base blocking. Remember, these two types of subluxations, they were very, very common. We tend to see them together. However, you can see posterior L5s and increased sacral base. With that type of condition, you normally want to pick one to correct before the other. Normally, I like to correct L5 first, then sacrum, but I don't do that all the time. Sometimes I will do the opposite scenario, but that's tends to be the rule of thumb, is normally L5 and then I mess with sacrum afterwards to see what we end up with.